Hey guys, today we're going to be testing the musculoskeletal system. So first we just want to inspect the patient's legs. The main thing we want to look at is make sure they're symmetrical. After we've looked at that, we want to test the skin characteristics, note any lesions or anything like that, any discoloration in the skin. Also, we need to look for the hair distribution. We want to make sure that it's equally on both sides. He's not losing hair in a certain spot. I know a lot of patients have that peripheral vascular disease, tend to lose hair in their lower extremities because there isn't good circulation getting to the hair follicle. After that, we want to palpate the popliteal pulse. We'll do this bilaterally on both sides. We want to do the posterior tibial pulse as well, making sure it's 2+, not weak and thready. And we want to do the dorsalis pedis pulse as well. We also want to look for any edema, so we'll kind of just press lightly on the skin, both sides, making sure there's no pitting edema that we need to address. After that, we want to look in between the patient's toes. Patients that have diabetes, this is particularly important. We want to make sure there's no cracks, lesions, ulcers, anything like that. If there is, we need to get prompt treatment for those patients because they could potentially lose a toe. Next, we want to test the range of motion of the hips. So we'll just get him to lift his leg up straight and then bend his knee to his chest. Good. Take the leg out straight again. Point your toes. Good. Press them back like you're pressing on a gas pedal. Good. Perfect. That just kind of tests the range of motion of the hip. Make sure there's no, there isn't any where he's not able to do anything like that. After that, we want to just look at the toes and make sure he can curl his toes up. Yeah, and then flatten them out. Good. Perfect. Next, we want to test the heel to shin. So we'll get him to lay down on the ground real quick. This tests for the cerebellar function. You want to lay your legs down flat. Good. You want to take the heel of one foot, place it on top of your knee, and I just want you to slide that heel down to your foot, all the way down, and then back up, and back up. All right, and do it again on the other side. This is what we do for patients. We want to assess if they've had potentially a stroke. We actually do this a lot for them. So this is a really good, important thing to do when you're assessing your patient's cerebellar function. All right, guys. Thank you.